The Honorable Gary Alejano is now recognized for his privileged speech.
Thank you, Madam Speaker. To our distinguished colleagues, magandang hapon po. I stand on the issue of personal and collective privilege on the need to strengthen and promote traditional and alternative medicine in the country. In 1997, then President Ramos signed the Republic Act number 8423, or the Traditional and Alternative Medicine Act. Traditional medicine is defined by the World Health Organization as the sum total of the knowledge, skills, and practices based on the theories, beliefs, and experiences indigenous to different cultures, whether explicable or not, used in the maintenance of health, as well as in the prevention, diagnosis, improvement, or treatment of physical and mental illnesses. According to the World Health Organization's fact sheet, more than 80% of the world's population depends on herbal medicine for health care. The Philippines has several traditional healthcare methods, and with more than 1,000 plant species that are believed to have medicinal properties, the enactment of RA 8423 opened many doors of opportunities. Republic Act 8423 aims to improve the quality and delivery of health care services to the Filipino people through the development of the traditional and alternative health care and its integration into the national health care delivery system. Likewise, Republic Act 8423 intends to promote and be able to provide an array of affordable, accessible, and effective traditional and complementary alternative healthcare options for our people to choose from. This act gave birth to the Philippine Institute of Traditional Alternative Healthcare, or the PTAC of Department of Health, which is designated to be in partnership with practitioners of traditional and complementary alternative healthcare modalities, and to vigorously pursue the implementation of this policy. To further aid in the promotion of alternative medicine in the country, then President, now Speaker Gloria Macapagal-Arroyo, issued Proclamation number 694, series of 2004, declaring the month of November, which is next month, as Traditional and Alternative Health Month. The proclamation stated that there are about 2,000 medicinal plants in the Philippines, and there's a need to accelerate the research and development of these plants for medical use. In addition, the Department of Labor and Employment encourages the development of herbal medicine as a source of livelihood. In its Balik Pinay, Balik Hanapbuhay program, the agency encourages returning overseas workers to start a home-based business, including herbal medicines and food supplements. Likewise, the Department of Health was quoted in Manila Bulletin on November 7, 2016, stating that the annual observation of Traditional and Alternative Healthcare Month seeks to heighten the public awareness of the availability and accessibility of traditional and complementary medicine and treatment, and educates the public on how to get the best benefit from the TNCM that make use of medicinal and pharmacological properties of herbal plants and other natural products which abundantly thrive in the Philippines. While all these events and activities suggest the overwhelming support of the government in promoting and developing traditional and alternative medicine in the country, recent events led by the Food and Drug Authority presents discrepancies with regard the intention of Republic Act number 8423 and how the government is supposed to be promoting natural medicine. On August 17, the Food and Drug Administration shut down the Dr. FARRAH Agustin-Bunch Natural Medical Center in Victoria, Tarlac. The center was closed for allegedly selling unregistered health products. Dr. FARRAH Agustin-Bunch is a well-known licensed medical doctor who specializes in alternative, natural, and affordable treatments to persons afflicted with advanced cancers and other serious ailments. She graduated from St. Louis University in Baguio City with a degree in medicine, is PRC licensed, and has received significant international training in her field. In 2015, just 3 years ago, Dr. Farrah and her husband founded the Dr. Farrah Agustin-Bunch Natural Medical Center with the goal of enhancing her practice as a physician, increasing her ability and capacity to service ill and dying persons from all over the country using natural medicine. The center is not a hospital, given the lack of emergency services and laboratories, nor does it have specialized machines and equipment, but is simply an outpatient clinic where patients can go for free consultations and treatment for their afflictions. There, Dr. Farrah manufactures thus enough of her herbal products known as Dr. Farrah's Boston C and Vitamin C, and others which are specially reserved for administered and dispensed to her patients and not the public at large. She received a license to operate number LTO 30000247997 for the manufacture of these health products, which were eventually applied for registration with the FDA, not to mention having undergone significant testing at a laboratory accredited by the Department of Health, the Department of Science and Technology, the University of the Philippines, and St. Luke's Medical Center. In spite of all this, there have been inexplicable delays regarding FDA approval. The Philippine Institute of Traditional and Alternative Healthcare, or PTAC, invited Dr. Farrah to have her facility be the showcase for natural medicine in the country and even host a residency program for natural medicine. Dr. Farrah's treatment facility was patronized by patients from all over the country and elsewhere, received popular support from notable personalities such as the appointed and elected officials, celebrities, and even royalty. Her treatments have gained notoriety all over the world, with many patients flying in daily from North America and Europe. Dr. Farrah gained a social media following numbering millions and became the largest employer in her municipality. On April 10, 2018, the presidents of the Philippine College of Physicians, Philippine Rheumatology Association, Philippine Society of Medical Oncology, Philippine Society for Microbiology and Infection Diseases, as well as the Philippine Society of Nephrology, filed a complaint with Health Secretary Duque through the Health Facilities and Services Regulatory Bureau of the DOH about alleged misconduct by Dr. Farrah in relation to the activities her treatment facility. No evidence nor aggrieved parties were presented. Again, on May 4, 2018, these same medical society presidents filed a similar complaint with FDA against Dr. Farrah. No evidence nor aggrieved parties were again presented. This was the only time in 16 years of medical practice or in the treatment of over 100,000 patients that Dr. Farrah ever faced a professional or legal complaint regarding practice as a doctor. On June 4, 2018, Dr. Farrah responded to the DOH complaint and argued that the Health Facilities and Services Regulatory Bureau and DOH do not have jurisdiction over her and also have no jurisdiction over outpatient clinics like her treatment facility. On June 11, 2018, Regional Office 3 of the DOH agreed with Dr. Farrah and rendered a decision dismissing the DOH complaint for lack of jurisdiction. On July 24, 2018, the Director of the Food and Drug Administration issued a summons with preventive measure order, or SPMO, directing Dr. Farrah to submit an answer to the FDA complaint within 10 days from receipt of notice. On July 27, 2018,
Dr. Farah received the SPMO with the FDA complaint in her treatment facility, which was served by the FDA through its regulatory enforcement unit. The summons provided that Dr. Farah had 10 days from receipt, which is July 27, 2018, or until August 6, 2018, to file an answer to the FDA complaint. On August 6, 2018, Dr. Farah, with the assistance of counsel, personally filed her answer to the FDA complaint, which was stamped, received, and provided with an acknowledgement receipt by the FDA in Alabang. Surprisingly, on August 8, 2018, the director of FDA rendered a decision for the FDA complaint and imposed upon Dr. Farah penalties of an administrative fine amounting to more than $1 million, permanent revocation of her license to operate, and the padlocking of several areas of her treatment facility. The basis for the closure was that Dr. Farah had not submitted an answer to the FDA summons, but actually she did. On August 17, 2018, at the precise moment, Dr. Farah was receiving an award at Club Filipino in Manila for her contributions to science and medicine. The REU, together with 10 media people and nearly 50 heavily armed officers of the Criminal Investigation and Detection Group of the Philippine National Police, personnel from the local government units of the Tarlac Province and Municipality Victoria Tarlac, serve a copy of the decision dated August 8, 2018 of Director General of FDA in Dr. Farah's treatment facility and proceeded to seize and confiscate her health products, seal the structures therein, and install closure signages within the compound. All the same is also where she resides. Clearly, Dr. Farah was deprived of her right to due process. Dr. Farah was able to submit her response to the FDA on August 6, 2018, well within the 10-day period that the FDA afforded her to file her reply. FDA completely disregard the defenses and arguments raised by Dr. Farah and her counsels. What is the reason for the extraordinary haste of the FDA in writing their decision? Did the FDA knowingly ignore the defense and arguments that Dr. Farah submitted? The hasty decision made the FDA neglected the rights of Dr. Farah to due process. It likewise denied Dr. Farah her right to practice her profession and to earn a living. But more importantly, the decision deprived many of our countrymen access to alternative sources of medicine as promised by Republic Act number 8423. On August 20, 2018, Dr. Farah filed a motion for reconsideration with FDA of the decision dated August 8, 2018, arguing that her right to due process was violated since she filed an answer to the FDA complaint that was not considered in the resolution of the FDA. Again, on August 29, 2018, Dr. Farah filed an urgent motion requesting the FDA to resolve her motion for reconsideration dated August 20, 2018. On October 4, after 44 days and daily follow-ups by Dr. Farah's counsels, the FDA answered the MR, but they maintained their oppressive and erroneous decision. They refused to admit that there is no pharmacy inside the facility and maintained the 500,000 fine it imposed for operating a pharmacy without a license and 72,000 for each day of operation. The center has no pharmacy, Madam Speaker. What it does have is a pharmacy, which is spelled as F-A-R-M-A-C-Y, pharmacy, or a central supply center or supply room which dispenses food and herbs. Also, FDA did not even acknowledge its patent error in its decision stating that Dr. Farah Natural Medical Center did not answer even if it did within the prescribed period of 10 days. Finally, FDA insists that the center has no pending application, which is false. It can also be noted that Sanofi Pasteur, the company behind the Dingvaxia vaccine, was only imposed a 100,000 administrative fine and suspension of its sale of the vaccine for a year, while Dr. Farah was meted out with a penalty amounting to more than 1 million pesos and permanent revocation of her license to operate, only for allegedly not providing an answer, which is a technical process, within 10-day period that was given them. The actions made by FDA not only prolongs the great uncertainty and hardship faced by the concerned, especially Dr. Farah, in terms of her right to practice her profession, but also, and more importantly, the right of the people who patronize Dr. Farah to choose the medical professionals and treatments they wish. While we recognize the mandate of the FDA to ensure that products peddled in the market are safe and of good quality and efficacy, we should also recognize the right of our countrymen to have access to affordable but effective traditional indigenous healthcare option backed by science as advocated by the Traditional and Alternative Medicine Act. In this regard, I urge the appropriate committee of this August chamber to review the implementation of Republic Act number 8423 in order to propose amendments that would improve and hasten the registration of products of alternative medicine advocates in our country, and also in consideration of the case of Dr. Farrah Agustin-Bunch, in order to strengthen the promotion of traditional, indigenous, alternative medicine in the country. With that, Madam Speaker, maraming salamat po at magandang hapon po sa ating lahat.
Majority Leader.
Madam Speaker, I now recognize the Honorable Anthony Bravo of Co-op for his interpellation.
The Honorable Bravo is now recognized for his interpellation.
Thank you, Madam Speaker. Good afternoon to our distinguished colleague. Will the distinguished representative of Party List Magdalo yield to some question for these representations?
This representation is willing to accept questions from Honorable Bravo.
Thank you, Madam Speaker, Your Honor. Just one information of my distinguished colleague. 2 months ago, I was able to travel with a group to China, and I've seen for myself how the government of China embraced alternative medicine. And in fact, I was able to visit at least 3 manufacturing companies wherein huge of money was infused by the government as far as research in manufacturing of alternative medicine. In the same manner, Madam Speaker, distinguished colleague, alternative medicine in China had been there, not just 500 years, but more than 500 years. And we have this law promoting alternative medicine in the country, but I don't know, where are we heading as far as Republic Act 8423 is concerned? The issue at hand that is being raised by the distinguished colleague, Madam Speaker, brought some controversies involving the Department of Health and its attached agency, the FDA. Distinguished sponsor, the FDA compliance letter, because I was able to come across personnel from FDA when this issue was raised during the budget hearing. And they said that a compliance letter was issued against Dr. Farrah, which includes operating a health establishment without a valid license to operate. Is she not violating a law?
Madam Speaker, distinguished colleague, Honorable Bravo, as I've stated in my privilege speech, the center of Dr. Farrah is an outpatient clinic, which does not require a license to operate from the Department of Health. In fact, the decision of the DOH on the complaints filed to them, they affirm that kind of findings that the clinic of Dr. Farrah is not a hospital and therefore not within the jurisdiction of the Department of Health. So hindi po siya hospital.
Further, distinguished sponsor, the personnel of FDA informed this representation that the FDA Registration Enforcement Unit found out that Dr. Farrah was operating as a pharmacy on the premise without a license. So therefore, they are covered by FDA. Is this correct?
Come again, distinguished Honorable Bravo.
The FDA Registration Enforcement Unit, distinguished sponsor, had reported that Dr. Farrah was operating as a pharmacy. So, if so, he is covered by FDA.
Madam Speaker, distinguished Honorable Bravo, it is unreasonable to require a different and separate license to operate for Dr. Farrah since she offers no pharmaceutical products at all. Yung sa kanya po, yung central supply room lang, kung saan mayroong food products, not drug products. And she possessed that license to operate as food manufacturer and not a drug manufacturer. The operation of central supply room for food products for the sole use and benefit of the patients of Dr. Farrah is but a natural consequence of and inextricably linked to the limited manufacturing of food by her in the medical center. To claim otherwise is not logical, Honorable Bravo, Madam Speaker. This is because while Dr. Farrah is allowed to manufacture food, she would not be authorized to reasonably dispose of it. It's just food. This would lead to the situation where the food manufactured by Dr. Farrah is left idle, open to expiration, and worse, unavailable to be given to sick and dying patients at the medical center. In fact, it makes no sense at all to penalize a person for not registering their products when they were not only granted authority to actually manufacture of these food products, but it's also still being evaluated. At the time that they were closed down, they have applied to the FDA for this kind of food supplement.
Thank you for that clarification, Your Honor. Madam Speaker. So, does it mean that you are giving impression to this body that the report, in fact, is not true or misleading?
Well, that's the information I received, Madam Speaker, Honorable Bravo. In fact, the FDA Enforcement Unit rating team's report, in the report, stated that the pharmacy was not padlocked because there was no drug found in them. So wala pong drug, kaya walang pinapadlock.
Was there any complaint filed by the client or patients of the said Dr. Farrah? As such, an initiative was made to investigate and close the establishment?
In fact, in my privileged speech earlier, ang nag-file ng complaints ay mga presidente ng different medical associations. No, 5 medical associations. And there was no complaint, a single complaint from a patient na kung saan ay nasaktan sila, nagkasakit sila, o namatay dahil sa panggagamot ni Dr. Farrah. So that means, hindi po totoo ang sinasabi na merong nasaktan. Dahil pag meron sa proseso ng FDA, na kung merong complaint sa mga produkto, no, na mga supplement o gamot, meron kang prosesong dinadaanan. Dapat mag-apply, mayroong form na dapat applyan mo, i-state mo doon, i-fill upan at pipirmahan, at dapat may proseso na iimbestigahan ng person from FDA. This did not happen at all, Madam Speaker.
Madam Speaker, distinguished colleague, I really wonder why this is happening. There was no complainant at all. And what trigger for them to close the establishment?
Sa pagkakaintindi ko, Madam Speaker, Honorable Bravo, technical issue lamang. Hindi nakapag-submit ng sagot within the 10-day required period of the complaints, the same complaint that was dismissed by the Department of Health, and also by the reason that, allegedly they're selling drug products. Now, in reality, nag-a-apply po sila ng food supplement. No? Ang gusto ko lang bigyan ng background po. When I was briefed with this, because I have so many constituents asking for my help. They're the patients of Dr. Farrah.
Ang application po food supplement na sinabit sa FDA, nakalagay doon na yung content ng vitamin C is 160%. So ang sabi ng FDA, hindi po ito dahil sobra ito ng 150% as the recommended energy and nutritional intake. So ang ginawa po ng grupo ni Dr. Farrah, binaba ng 150. Ngayon, nung nag-comply na sila, at pinakita in fact sa shelves ng ating mga stores in the groceries, makikita natin doon na even yung mga vitamin C juices and products, merong 200%, 250%, but they were not classified as drugs. So therefore, medyo oppression yun na ito ay specific sa kanya na 150%, hindi siya in-approve. Nung na-approve yung kanyang contents on 150%, ang nilagay naman doon, hindi ba ito gamot dahil nilagay mo, Dr. Farrah? So tingin ko hindi rin, no? Dahil nakita ko rin sa kanilang reasoning in their exchanges sa application, maraming mga produkto that contain the name doctor. Now, because Dr. Farrah is a doctor, so she has to put there Dr. Farrah. So doon sa mga ibang mga produkto, example, sulfur zinc oxide, Dr. Kaufman. Bakit pinayagan ito ng FDA? Doon sa doctor's schools, liquid corn callus remover, pinayagan din ito. Meron ding Dr. Nutri. This is green coffee mix. Pinayagan, may doktor din naman, no? So, nung yan ay binigay na rason, sinabi pa, bakit nakalagay dito doctor recommended? Therefore, this is a drug product. Madam Speaker, Honorable Bravo, maraming produkto pong naglalagay niyan. In fact, doon sa isang tubig na produkto, nakalagay doon, recommended by doctors. So, it's just wording, Honorable Bravo. At the end of the day, nag-comply ho sa requirements. And I cannot just understand the harsh decision of FDA if they tried to comply with the requirements. I've learned that Dr. Farrah came from abroad and she decided to go home in order to help the Filipino people. And, she achieved so much in terms of research, in terms of development of alternative medicine. I asked Department of Health, in fact, during the budget hearing, kung anong estado ng ating alternative medicines. Ang PITAC nagbigay ng napakahabang litanya ng accomplishment ng PITAC. In fact, resource person pa nila si Dr. Farrah. And why is it na very harsh ang treatment ng FDA when it comes to the, application of Dr. Farrah to the point of even revoking her license to operate? Honorable Bravo.
Thank you, distinguished colleague. Madam Speaker, our intention of scrutinizing or doing such inspection on establishment is to assure, among others, that if a such establishment is existence or giving services, we are assuring that public is safe. It includes the report, because it is included in the report of FDA, that this establishment is prescribing inappropriate health products which allegedly cause worsening of condition of the patients, and in fact, citing some death incidents. That's why I'm worried. Is this really true? Because it's part of the report.
Well, again, I'm not questioning the report, but let us make sense of that report. There was no complainant. It should be specific who is or who are the victims, ano nangyari sa kanila, and katulad po sa debate natin sa Dingvaksya. No, nagkaroon tayo ng hearing sa Dingvaksya. Bago ang allegation is that namamatay itong mga batang naturokan ng Dingvaksya. Pero hindi automatic na sila ay namatay kaagad dahil naturukan sila. You have to go through the process of determining whether the substance of the Dingvaksya caused the death of the patient. In this case, Madam Speaker, Honorable Bravo,
paano malalaman na itong mga sinasabi, ito wala pang pangalan na walang complainant, paano malalaman that they died because of the food supplements administered by Dr. Farrah? Walang ang laboratory examination or whatsoever na ginawa to say that the Boston C or vitamin C offered by Dr. Farrah was the cause of such death.
So meaning, Madam Speaker, distinguished sponsor, the report that is being shown to public is quite not reflecting the truth, which is supposed to be giving us an impression that it's a semblance of fake news. Madam Speaker, distinguished sponsor.
Well, Madam Speaker, I agree with that because I believe that we need to have a comprehensive committee hearing on this so that we can ferret out the truth. Because my concern, Madam Speaker and Honorable Bravo, is that aside from the injustice, aside from the violation of laws and processes, this certain situation discourages scientists, discourages doctors that conduct research on alternative medicine. This is actually encouraged in our country. The fact that we passed Republic Act 8423 recognizes the fact that there are so many medicinal plants in the country that can provide cure to the problems. Alam ho natin, pag may sakit ka lalo na cancer, hindi naman mayaman lahat. Ang daming mahirap na Pilipino. Ang cancer ay hindi lamang sakit ng mayaman, sakit din ng mahirap. Ngayon, kung pupunta ka sa mga doctors na napakamahal ang mga treatments, bayad professional, at ang gamot na binibigay ay napakamahal, it is but understandable na pupunta ho sila sa alternative medicine dahil wala mo silang kakayanan. Ngayon, nire-regulate natin ang alternative medicine para hindi naman ho sila mapahamak. Ngayon ho, ini-encourage natin ang research. Tama o yung sinabi ni Honorable Bravo kanina, in China, herbal medicine traces its roots thousands of years ago in China. In fact, up to now, sa Quiapo, napakarami niyan. No?
At hindi sinasara.
Ano po?
Kung meron ho sa Quiapo, meron bang ginawang investigasyon at naisara?
Yun din ang dapat nating malaman because so far in my own investigation, parang wala ho tayong narinig. Na hindi lamang sa Quiapo, sa Green Hills, when I went there, may nakita din ako mga products na gano'n, no? So, for me, Madam Speaker and Honorable Bravo, we should create an atmosphere conducive for our scientists to create and develop medicines for our sick people. Hindi yung prohibitive yung process natin. At alam ho natin yung findings natin sa issue ng Dengvaxia. Labanan ito ng malalaking pharmaceutical companies. Even on the issue of development of alternative fuels. Maghahanap ka ng alternative na ginagawa ng ating mga scientists, hindi po nabibigyan ng support. Why? Ang lakas ng labi ng oil companies, mawawalan sila ng pagbebenta. Ito rin sa alternative medicine, mawawalan din ng benta ang malalaking pharmaceutical companies. And therefore, tayong representative should side with the interests of the Filipino people, not with the profits of big pharmaceutical companies.
Balikan ko lang ho, Madam Speaker, distinguished sponsor, ang pagpapakasara ng establishment. Dumaan ba ng tamang proseso? Meaning, kung merong nag-complain o merong findings ang isang agency ng gobyerno, bago mo ipapasara ang isang establishment, kailangan may prosesong daanan. At nasundan pa yung tamang proseso.
Well, sa tingin ko, Madam Speaker, Honorable Bravo, ay hindi po sila dumaan sa proseso. Una, very harsh now technical. You were not able to respond to the summons within the prescribed period, which is 10 days. But in reality, they submitted. There's a receipt copy of their response, no? And aside from that, yung sinasabing gamot na illegal daw, nakaproseso, naka-apply sa kanila. When I asked the director of FDA during the budget hearing, meron bang nakapending na application sa inyo? Sabi niya, wala. Again, I want to put that on record, Madam Speaker, Honorable Bravo, na hindi po totoo. Because Dr. Farrah applied for the approval or accreditation of their products. So, hindi nagsasabi ng totoo ang FDA. And aside from that, parang overkill. It was reported in the news. I was able to read from the news na overkill. Nagdala ng napakaraming pulis at sinara yung facility na yan na parang pugad ng mga terorista.
Maraming salamat to, distinguished colleague, Madam Speaker. With that comprehensive information you have given us, this representation fully support for the conduct of investigation as propounded by distinguished Representative of Magdalo, Honorable Gary C. Alejano. Maraming salamat po.
Maraming salamat, Honorable Bravo. And maraming salamat, Madam Speaker. Magandang hapon po sa lahat.